Right, not sure about a recommended medical procedure. Should you get a second opinion? Joining us live now is Hartford Healthcare surgeon Dr. Danielle Friedman at St. Vincent's Medical Center and a Quinnipiac School of Medicine professor. Welcome, Dr. Friedman. Thanks for joining us on Good Morning Connecticut at 9.
Good morning. Thank you so much for having me.
Of course. So you recently wrote this article about how it is a patient's right to get a second opinion. Clearly you feel strongly about this. Why is that the case?
I think it's something in medicine that can be very intimidating to a lot of people and perhaps even feel like it damages the relationship between a physician and a patient, but it can actually be incredibly empowering for patients.
Of course, this is a very, important time for them when they receive a diagnosis. It can be tough, of course. And like you mentioned, I mean, some doctors might get offended. Clearly, you don't. How often do you get asked for a second opinion?
I probably get equal numbers of patients who want to get a second opinion after seeing me and those to whom I give a second opinion, at least a couple of times a month, I would say.
A couple of times a month. Wow. So when it comes to getting a second opinion, I mean, what do you recommend patients do in order to get that second opinion? And how much should they rely on friends and family as well, their support system? Because as I mentioned, this can be an incredibly tough time emotionally for the patient.
I think having that support system is very important, both emotionally, but also logistically. Having a support person at an appointment to help keep track of the information from a first opinion can help someone really assess the communication with a first provider and help decide if there were points that needed to be clarified or better communicated and potentially benefit from a second opinion.
Now, is there a time where a patient needs to go beyond that? I mean, we don't hear about it too often, but even getting a third or a fourth opinion, are there any circumstances like that you would recommend a patient goes beyond the second opinion?
As you said, that's pretty rare. They've actually done large studies about this in many different medical fields, and it's extremely uncommon for someone to continue to feel past a second opinion that they need more information. And fortunately, there aren't really any diagnoses where it's been proven to be helpful. So two is usually enough.
Two is the magic number here. As I was mentioning, it can be a bit distressing. Some people take this news in different ways. Of course, they process it in different ways. So what would you recommend if somebody gets a diagnosis or they get some news from a doctor that makes them feel a little bit stressed or sad, maybe anxious or depressed? What are some things that they can do to cope and maybe lower their level of stress?
I think one, leaning on that emotional support system, but also making sure that they understand the information they've been given, taking a little bit of time to process what they've been told, asking sometimes for printed information or additional reliable sources of information on the internet where they can both ask and come up with more questions. That can really help clarify because we know that when someone gets an unexpected diagnosis, they only hear about 50% of the information at that visit.
Really good advice there. Dr. Danielle Friedman, we thank you for your time today.